Now what happens is, if we do it 1 or 2 levels, these levels fuse and they don't move with respect to each other. Now if they don't move, then the rest of the segments in the lumbar spine will do extra work to compensate for the lost motion. If someone is advised to undergo spinal fusion surgery, will they lose the flexibility in their spine? Will they be able to bend like the way they did before? It is a very sensible question to have if you are going to undergo spinal fusion surgery or you have had spinal fusion surgery. Now, see, what happens is spinal fusion surgery commonly is done in the lumbar region. It can be done anywhere in the spine, any region, but yes, we'll talk about the commonest things first. Now, if it is done in the lumbar region, commonly we do it for 1 level, 2 level, 3 levels. Now, what happens is, if we do it 1 or 2 levels, these levels fuse and they don't move with respect to each other. Now, if they don't move, then the rest of the segments in the lumbar spine will do extra work to compensate for the lost motion of this fused segment. So, over a period of time, the patient as such does not experience any loss of flexibility or range of motion. Some stiffness might be there, but with physiotherapy, yes, we can regain again like the flexibility it was before. So they are able to bend like the way they did before. They can sit cross-legged on floor if they want to. They can do yoga, they can do Pilates. So the flexibility pretty much remains preserved. Now, if suppose we are doing a long segment fusion, like for scoliosis, we do long segment fusion depending on the curve, or for some reason we are doing a long segment fusion, then yes, some stiffness is expected after surgery. But again, in this situation, if we optimize the physiotherapy, then we can regain most of the flexibility. Now, it also depends on which region of the spine the surgery is performed on. Now, if we are doing in the thoracic spine, there is not much range of motion in the thoracic spine anyway. So even if it's a long segment fusion in the thoracic spine, you are not going to lose as much of flexibility as you would if it is done in the cervical or lumbar region. Now, if fusion surgery is done between C0, C1, C2, then this movement, turning your head sideways, is done at C1, C2 level. So yes, there will be some restriction of this movement. If it is done at C0, C1, which is occiput and C1, then nodding of head like this is going to be affected. So yes, at a higher cervical region, C0, C1, C2, nodding of the head, turning of the head will be compromised. This flexibility will be compromised. But if it is done below C2, not much of the range of motion is going to be affected. Some stiffness, yes, will be there, but we can work closely with a physiotherapist to help us regain our flexibility. So to summarize, if you have spinal fusion surgery, you do not really have to worry about the flexibility of your spine if you follow the precautions after surgery and work closely with a physiotherapist to help you regain your flexibility back again. Now, there will be some precautions like you do not have to bend, you do not have to arch your back, but that is for everyone. More so for these patients who have had spinal fusion, that if you have to bend, you should bend with your back straight and not arch your back. So if you take all these precautions, your flexibility in the spine will not affect your daily routine and you will be pretty much back to your normal function as you were before. Thank you so much.